Hi, my name is Catriona Mackenzie. I work for a private consulting company called Ausvet. We deal mostly with Global One Health. Discussing with participants new ways of thinking about information systems and about engaging people at the front line, if you like, much more in the detection and notification of diseases. We talked a lot about the motivations of people, people's fears, the threats people feel, their needs, their own information needs, and their interests. What are their personal priorities? So instead of traditional systems which are very much top-down, they're asking for reports to be sent up to the central level for decision makers, we turn things on their heads and we're asking people to think more about the people at the front line. That's producers and farmers. That's also all those veterinary services out there who are working very hard every day. And what are their needs and motivations? And we talked a lot about what can we do to gain their loyalty, their confidence and trust, and improve the level of notification of diseases for early detection, to improve the engagement that these stakeholders have in the role of early detection for national control and response. It's incredibly important. There are eyes and our ears, and sometimes our systems leave them out. So we've been talking a lot about that today. It's been incredibly interesting. One of the things that I've learned over the years of experience is that if you build a system more for the frontline staff and the producers, we meet their needs first. The needs of central level and other levels of government, their needs are met as a byproduct of what ends up being quite routine, daily, a daily tool to use in the field for data collection for all sorts of purposes. And we value add data by adding more data, by connecting data, by integrating other sources of data, and by scientific rigor and very useful outputs. We help people to use their data more quickly, more in a targeted way. We help them to understand what they're looking at by providing people with tailor-made analyses so that they can use that information in the field immediately. These kinds of new real-time systems, we know about them from the commercial world, the world of the social media, and all other aspects of life are dominated by these sorts of information systems that in fact drive service. But we haven't really got it right with animal health. We keep on kind of playing around with some of these ideas. In other countries, for example Indonesia, we've seen absolutely phenomenal success with these systems, and there's very little reason why we can't, as a team, build an integrated system for the region to help everyone, put everyone really on the same page by meeting the frontline workers' needs and feeding that information up to the response and with the response teams. That's really going to be the focus. Drive the new style of system with service and good information, the good use of information, and very much facilitated communication of alerts and automated systems to make sure that the right people have the right information at the right time so they can do their jobs better. It's essentially that. It's been such a pleasure to work with everyone during this EuFMD workshop, supported by FAO. It's been fantastic, and everyone's really receptive to these new ideas. It's a little change of how you think normally, but it's been very engaging for everyone.